I've definitely observed some trauma-informed care, not only at my current site and my current rotation, but also at my previous site and my previous rotation at Kindred Hospital. I also have experience working as well as interning in multiple different types of behavioral units where I've gained really valuable knowledge on this subject. I've noticed that when it comes to trauma patients, specifically ones that may have had an unhealthy relationship with food in the past, which tends to be the patients that I see a little bit more often in these units, given my role as an intern and as a dietech. It's extremely important to choose your words and overall approach wisely. With these types of patients, trigger words such as weight, calories, fat, diet, etc., are oftentimes avoided because they may trigger unpleasant feelings for the patient, and that might lead them to not wanting to really speak with you or engage with you, and that's going to make your job as the provider a lot more difficult. Once you once you identify yourself as the dietitian, they usually become immediately defensive because they think that you're going to interrogate them about their diet or why they haven't been eating or why their weight's been dropping, etc. So using open-ended questions in situations like this have shown to be really effective in my experience when I've done it myself and when I've seen RDs do it. Asking things like, what does a normal day of eating look like for you? What are some average snacks that you may consume on a daily basis? What are some things that you like eating? What are some things that you don't like eating? This really gives them the floor to talk about their situation, or not if they choose not to, which I've also seen happen. A really effective approach that I've seen being used and one that I've practiced a little bit myself is one that really focuses on creating a safe space with the patient and building a relationship with them. I've heard RDs say things like, don't worry, I'm not the food police, or things like that, just to lighten the situation up a little bit, and also reinforce that they're not here to press you as the patient. They're not here to ask you uncomfortable questions or dig up things that you don't want to talk about. Even when seeing a patient who clearly has been restricting themselves of proper nutrition, if they have significant weight loss or significantly low BMI, or even if you're just visually looking at them and they look like they're just malnourished, the questions would always sound like, would you be interested in a nutrition supplement? Would you be interested in adding a snack, a Greek yogurt? What are some things that you might be interested in having on a daily basis while you're here? Instead of, I really think you should be drinking a supplement, or I would really recommend a Greek yogurt. I would really recommend it, ensure, because of your weight or because of your labs or whatever the case may be. And I've noticed that asking the patient if they're comfortable with the intervention before even explaining what the intervention is and why you're recommending it, it's been really effective because you're giving them a choice instead of forcing them to comply or pushing them to comply. And I think that when I'm eventually in a situation like this, as a registered dietitian, I'm going to improve my MI skills by really focusing hard on open ended questions and reflective listening. I want to make sure I'm not only physically, but also emotionally present for the patient when I'm having this conversation with them. And I'm going to utilize, the open ended questions to gauge the patient and try and figure out where their relationship with food actually stands. And this is going to allow me to individualize my approach specifically to that patient. This will hopefully allow them to trust me a little bit more, and I can implement nutrition interventions accordingly and more effectively.